Hello friends, today is day 2 of Neet PG live class, which happens usually at 9:30 p.m. every day. Today we will deal with the subject obstetrics and gynecology. Zygote with zona pellucida reaches uterine cavity by A 2 days, B 4 days, C 5 days, and D 6 days. Zygote with zona pellucida reaches uterine cavity by A 2 days, B 4 days, C 5 days, and D 6 days. Zygote with zona pellucida reaches the uterine cavity by 4 days. The role of human placental lactogen. Now we all know what HPL is, human placental lactogen. 4 options have been given. A. Stimulates the milk production. B. Fetal breast development. C. Growth of fetus. And D. Endocrine regulation. Now, this HPL, that is human placental lactogen, provides fetal nutrition by antagonizing the action of insulin in maternal circulation. HPL, it creates new blood vessels. Fetal vasculature is improved. It is angiogenic. HPL causes the growth of breast for lactation in the mother. So the correct option here appears to be growth of fetus. Let us look what the correct option is. The correct option here is growth of fetus. So the role of human placental lactogen is growth of fetus. Most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tube, B. Isthmus, C. Ampulla, and D. Infundibulum. It is definitely ampulla. Let us see what is the correct option here. It is ampulla. The most common site of implantation of tubal pregnancy is ampulla. Can anybody tell what is the maximum propensity to rupture in case of ectopic pregnancy? It is the isthmic ectopic pregnancy which ruptures very easily. And minimum propensity to rupture is the ampullary ectopic pregnancy. So the most common site of implantation of tubal pregnancy is ampulla. During which gestational age is peak serum hCG level attained? During which gestational age is peak serum hCG level elevated? Now let us look the 4 options. A. 7 to 9 weeks, B. 11 to 13 weeks, C. 20 weeks, and D. 25 weeks. Now, one fact I want to tell you is that hCG levels double every 30.9 hours. After every 30.9 hours, the hCG level doubles. hCG level reaches a maximum of 6,500 international unit per liter at about 8 weeks. After that, hCG level remains more or less constant. Then it falls down between 12 to 16 weeks. So the correct option here is A. 7 to 9 weeks. So peak serum hCG levels are attained at 8 weeks, that is between 7 to 9 weeks. What would be type of presentation when engaging diameter is mento-vertical? Mento-vertical. This mento-vertical, the engaging diameter is about 14 centimeter. So the correct option here is B, bro. Bro. It is very rare. It is very rare. So bro presentation, it is mento-vertical, 14 centimeter. Now let's move to the next question. Most common cause of secondary PPH. Now what is secondary PPH? Secondary PPH or late PPH occurs at 8th to 14th day of delivery. Postpartum hemorrhage at 8th to 14th day. The most common cause of this PPH is retained placenta. Other causes are infection and separation of a slough over the deep cervico-vaginal laceration. Suppose there is a deep cervico-vaginal laceration. When there is an infection and separation of slough over the deep cervico-vaginal laceration, it leads to the secondary PPH. Other causes are endometritis, subinvolution of placenta. Endometritis, subinvolution of placenta. So most common cause of secondary PPH is B, retained placenta. You can WhatsApp me directly on 948-365-2020 for any doubts during the preparation. So the most common cause of secondary PPH is B, retained placenta. Incidence of scar rupture in a subsequent pregnancy in case of lower segment cesarean section, that is LSCS, is A, 2%, B, 4%, C, 5%, and D, 8%. See, the incidence of scar rupture is very low. It is about 0.5 to 1.5%. So the nearest option here is 2%. Even if the scar ruptures, the chances of dying with scar rupture is very, very less or negligible. So the correct option here is A, 2%. Subpubic angle is A, less than 65 degree, B, 65 to 75 degree, C, 85 degree, D, 110 to 120 degree. Subpubic angle is 85 degree. So correct option here is C, 85 degree. Rule of Hasse. We all know rule of Hasse is used for detection of the age of fetus. So rule of Hasse is used to determine, 4 options are given: the age of fetus, the B, the height of an adult, C, the race of a person, D, identification. This question can be asked in forensic medicine also. So the rule of Hasse is used to determine the age of fetus. Correct option is A. Now indication of acyclovir in pregnancy. A, disseminated herpes. B, chickenpox in first trimester. C, prophylaxis in recurrent herpes. And D, all of the above. The correct option here is D, all of the above. So acyclovir is used in disseminated herpes also, chickenpox in first trimester also, and prophylaxis in recurrent herpes. Human placenta is A, discoid, B, hemochorial, C, deciduate. Yes, of course, human placenta is discoid also, it is hemochoroidal also, and it is deciduate also. So the correct option is D, all the above. Hot flushes are experienced as a result of A, increased noradrenaline, B, decreased estrogen, C, increased noradrenaline and decreased estrogen, and D, increased noradrenaline and estrogen. So hot flushes are experienced because of increased noradrenaline. Increased noradrenaline. What this noradrenaline causes? It disturbs the thermoregulatory mechanism. As a result, hot flushes are formed. So hot flushes are experienced as a result of increased noradrenaline and decreased estrogen. So the correct option here is C. Increased noradrenaline and decreased estrogen. Cephalic index is, we all know cephalic index is biparietal diameter upon occipitofrontal diameter. So the correct option here is BPD upon OFD. That is biparietal diameter upon occipitofrontal diameter, which gives the cephalic index. So the correct option here is A. BPD upon OFD. In MRKH syndrome, which among the following is absent? A. Vagina. B. Breast development. C. Pubic hair development. D. Testes. Now, MRKH. What is the full form of MRKH? Mayer, Rokitansky, Custer, Hauser syndrome. Mayer, Rokitansky, Custer, Hauser syndrome. In Mayer, Rokitansky, Custer, Hauser syndrome, there is Mullerian agenesis, renal aplasia, and cervicothoracic somite dysplasia. Now, what is the karyotype? It is 46XX. It is a normal karyotype, 46XX. In MRKS syndrome, ovaries are present. Whereas in androgen insensitivity syndrome, testes are present. Androgen insensitivity syndrome, testes are present. So what happens in MRKS syndrome? In MRKS syndrome, there is congenital aplasia of the uterus. And upper part of 2/3 of vagina. Upper part, that is 2/3 of the vagina. The karyotype is 46XX karyotype. Then secondary sex characters are normal. So the correct option here is testis. Testis is present in androgen insensitive syndrome. In MRKS syndrome, ovaries are present. So the correct option is D. Testis is absent in MRKH. Polyspermy is inhibited by which ion? A. Calcium. B. Na. C. Potassium. D. Chloride. Polyspermy is inhibited by which ion? Which ion inhibits polyspermy? Think about it. I will give you some time. Think about it. Polyspermy is inhibited by which ion? Whether it is calcium, sodium, potassium, or chloride. Calcium, sodium, potassium, or chloride. Let us see what the correct option is. Polyspermy is inhibited by calcium. A. Polyspermy is inhibited by which ion? Calcium. Maximum amniotic fluid is present at A. 32 weeks, B. 34 weeks, C. 36 weeks, D. 40 weeks. So correct option here is C. 36 weeks. At 36 weeks, maximum amniotic fluid is present. Fertilization usually occurs in which part of fallopian tube? Fertilization usually occurs in ampulla of fallopian tube. Physiological change in leukocyte numbers in pregnancy. A. Neutrophilic leukocytosis. B. Lymphocytic leukocytosis. C. Neutropenia. D. Basophilic leukocytosis. The correct option here is neutrophilic leukocytosis. Weight of uterus at term is A. 400 to 500 gram. B. 600 to 700 gram. C. 800 to 900 gram. D. 900 to 1000 gram. So the correct option here is D, 900 to 1000 gram. Urinary retention earliest in pregnancy is seen at. Now, urinary retention usually occurs at 10 weeks. So the correct option here is 10 weeks. Down syndrome is earliest diagnosed at A, 8 to 10 weeks, B, 10 to 12 weeks, C, 12 to 14 weeks, and D, 14 to 16 weeks. It is 10 to 12 weeks. Earliest diagnosed at 10 to 12 weeks. Now, when is folic acid started in pregnancy? This is a very important question. When? When do you think it is started, folic acid? Obviously, it started before pregnancy, but how many weeks? A, 4 weeks prior to conception. B, 8 weeks prior to conception. C, 4 weeks after conception. No, there is no point in giving after conception. D, 8 weeks after conception. So the correct option here is A, 4 weeks prior to conception. Term placenta weight to baby ratio is, this is a clear cut question. It is 1:6. What are the options given? A, 1:3, B, 1:4, C, 1:5, D, 1:6. So the correct option here is D, 1:6. Persistence occipito-posterior position is most common in which pelvis? Persistent occipito-posterior position is most common in which pelvis? B, A, android, B, gynecoid, C, anthropoid, D, mixed. This persistent occipito-posterior position is present in android pelvis. So correct option here is android. Pregnant uterus will compress ureters A, at pelvic brim, B, uterovesical junction, C, trigone, D, uretrovesical junction. So the correct option here is A, pelvic brim. Let us look at all the questions, revise one by one. Zygote with zona pellucida reaches uterine cavity by A, 2 days, B, 4 days, C, 5 days, and D, 6 days. Click in the option, whatever you know. It is B, 4 days. The role of human placental lactogen is A, stimulate milk production, B, fetal breast development, C, growth of fetus, D, endocrine regulation. So the correct option here is C, growth of fetus. Most common site of implantation of tubal pregnancy is A, interstitial portion of fallopian tube, B, isthmus, C, ampulla, and D, infundibulum. It is ampulla, C. During which gestational age is peak serum HCG level attained? A, 7 to 9 weeks, B, 11 to 13 weeks, C, 20 weeks, and D, 25 weeks. So correct option here is A, 7 to 9 weeks. What would be the type of presentation when engaging diameter is mento-vertical? Again, mento-vertical means bro presentation. A, face, B, bro, C, vertex, D, breech. Correct option is B, bro presentation. Most common cause of secondary PPH is retained placenta, we all know. So the correct option here is B, retained placenta. Incidence of scar rupture is very low in the subsequent pregnancy. In case of LSCS is about 2%. A, 2%. Now subpubic angle is 85 degree. A, less than 65, B, 65 to 75, C, 85 degree, D, 110 to 120 degree. So the correct option here is C, 85 degree. Rule of Hasse is used to determine the age of fetus. So correct option is A, the age of fetus. Indication of acyclovir in pregnancy is A, disseminated herpes, B, chickenpox in first trimester, C, prophylaxis in recurrent herpes. Yes, all of them. Correct option here is D, all of them. Human placenta is A. discoid, hemochorial, B. deciduate, D. all of them. Hot flashes are experienced as a result of increased noradrenaline and decreased estrogen. Correct option is C. Cephalic index is BPD upon OFD. Correct option is A. In MRKH, Mayer-Rokitansky-Kuster-Hasse syndrome, what happens in MRKH? Which among the following is absent? Testis is absent. Testis is absent. Secondary sex characters are normal. MRK, Mayer-Rokitansky-Kuster-Hasse syndrome. There is Muller-Agenesis, renal aplasia, cervicothoracic somatic dysplasia. In androgen insensitivity syndrome, testes are present. In androgen insensitivity syndrome, testes are present. Polyspermy is inhibited by calcium ion. A, C+. Maximum amniotic fluid is at 36 weeks. C, 36 weeks. Fertilization usually occurs in which part of fallopian tube? It is ampulla. B, ampulla. Physiologic change in leukocyte numbers in pregnancy is A. neutrophilic leukocytosis, B. lymphocytic leukocytosis, C. neutropenia, D. basophilic leukocytosis. Correct option here is A. neutrophilic leukocytosis. Weight of uterus at term is A. 400 to 500 gram, B. 600 to 700 gram, C. 800 to 900 gram, D. 900 to 1000 gram. Its correct option here is D. 900 to 1000 grams. Urinary retention earliest in pregnancy is seen at A. 10 weeks, B. 18 weeks, C. 22 weeks, D. 34 weeks. It is 10 weeks. Down syndrome is earliest diagnosed at 10 to 12 weeks. B. When is folic acid started in pregnancy? 4 weeks prior to conception. A. Term placenta weight to baby ratio is 1:6. D. Persistent occipital posture is most common in which pelvis? It is common in android pelvis. Pregnant uterus will compress ureters at A. pelvic brim, B. uretrovesical junction, C. trigone uretrovesical junction. It is pelvic brim. I wish you all the best. Tomorrow again at 9:30 we will meet with another subject. Tomorrow. Wishing you all the best. You can call me or WhatsApp me on 948-365-2020. You can click the link in the description box to join my free Neet PG Masterclass.